object, the female breast. You have to know that female breast, the base, the tail, areolar lobes, suspensory ligaments, supramammary nipple, blood supply, lymphatic drainage, and types of mastectomy. The female breast, the breast or the mammary gland are a skin gland capable of secreting milk. Being a skin gland, the breast is situated in the superficial fascia and has no capsule. The figure shows you that. The base of the breast. The base of the breast. The breast can be easily separated from the deep fascia covering pectoralis major, serratus anterior, and external oblique muscle on the anterior thoracic wall. In spite of difference in the size and the shape of the breast, the size of the base of the breast is fairly constant. The base of the breast is extended from the second to the sixth rib in the mid-clavicular line. The base of the breast extends from the edge of the sternum to the mid-axillary line. The axillary tail extends upward and laterally along the inferior border of the pectoralis major muscle. The axillary tail is important because it contains a large amount of the glandular tissue, and a greater percentage of breast cancer can occur there. The axillary tail, the whole breast, is superficial to the deep fascia, while the tail, or what we call it, the spines part of the breast tissue, enter the hiatus of longer fascia of the mid-axillary and the deep fascia of the medial axillary wall. This is the only part of breast tissue found under the deep fascia. The axillary tail can be visible as a definite mass simulating the axillary tumor, but this mass is reactively can be changing in the size during the menses. The areola is the hyperpigmented skin area surrounding the nipple. The areola contains subcutaneous gland of Montgomery. The areola gland enlarged during the pregnancy and secreting an oily material that protects the areola and the nipple from the friction or sucking of the child. The areola is variable in size and the skin. The depth of the color depends on the woman race. The normal color skin in the white females, while and nulliparous women, and in Negroes it will be dark brown. The size and the color. During pregnancy, the areola enlarge and become deep brown to the black. The color diminished after pregnancy but never changed to the normal pink color. At the puberty, the areola enlarge and become more pigmented. Also, the increase in the size and the shape and the rounding and the increase the contour of the breast during the old age group. The small collection of smooth muscle fiber located at the base of the nipple may cause erection of the nipple during nursing or sexual intercourse. The right one show you relaxed area, the left one show you the contracted area. The breast lobes. There are 15 to 20 lobes of glandular tissue. Each lobe is drained by lactiferous ducts. The lactiferous duct extend from the nipple radial manner like spokes of the wheel. تشبه المخود مال السفينة. The benefit of this, the underlying areola. Each duct has a dilated part called the sinus, in which milk accumulated during lactation. The craniocaudal projection of the ductal gram can be shown at this process. Suspensory ligament. The lobes are separated from each other by a fibrous septum, which called the suspensory ligament of the breast, and its name Cooper ligament. The suspensory ligament extends from the deep fascia toward the skin, so it will separate the lobes. This is mammogram, one of the investigation showing the process of detection any abnormal mass or abnormal tissue inside the breast. Suspensory ligament maintain the breast form in upright posture. Let's work it. The value of the suspensory ligament maintain breast form in upright posture is the main evidence when a person lie on her back and bend forward, where in each cases the suspensory ligament are less effective in the control. Suspensory ligament, malignant type or malignancy infiltrating the suspensory ligament so that it will pull, shortening and invagination of the skin overlying the areola. So it's one of the type or in diagnosis of breast cancer. Also, the benefit of suspensory ligament. During abscess infection in the breast should be open. These abscess should open in incision radial part to avoid cutting to the number of lactiferous duct. First, or damage to suspensory ligament, which will that prevent the spread of infection from one lobe to each other if we cut it across the suspensory ligament. Supramammary gland. Humans normally have one nipple on each side at the anterior aspect chest wall. During embryological development, a milk line of multiple nipples extends from the upper part of the axillary region down to the mid-inguinal region. Usually will disappear, and the remaining only anterior chest wall. But this in other species, cat, dogs, persists. This mammary line persists, so there will be multiple nipples. Occasionally supermammary or extra nipple are or in the breast may be developed along the milk line. In this figure show you that a nipple or the areolar type are under the axillary region are secreting milk. Arterial blood supply. First, blood supply is by internal thoracic artery, by the perforating mammary branches that perforate the pectoralis major muscle. The internal thoracic artery is one of the blood supply of the subclavian artery. At the second and third intercostal spaces, this perforating artery will be large in female, and the thoracic of the female. The internal thoracic artery, its thoracic branches supply most of the blood breast. Another one, its branches of the axillary artery. Number one, lateral thoracic artery. Pectoral branch of the thoracoacromial artery. Supramammary thoracic artery. The intercostal artery number 3 has a large number of perforating so that it will supply most of the second, third, fourth intercostal regions. The venous drainage corresponding to the artery. The chief main blood venous drain is toward the axilla. The intercostal vein also communicate posteriorly with the vertebral venous plexus. So this communication has no valve so that metastasis can be spread by breast toward the skeleton, and this will explain the metastasis of the cancer of the breast toward the skeletal system and the back and the vertebral column. The venous spread of the breast cancer may be reached the liver through portal, cable, and anastomosis. Lymphatic drainage of the axillary vessel node, which constitutes the major drainage area of the breast. Internal thoracic vessel or parasternal lymph nodes located along these vessels. Although the lymph vessels communicate freely between the lobes of the breast, but there is tendency for the lateral part of the breast to drain toward the axillary and the medial part toward the parasternal lymph node. 60% of the carcinoma of the breast occur in the upper lateral quadrant and thus undergo metastasis to the axillary lymph node. Lymphatic obstruction usually a pathway take obstruction of the usual lymphatic pathway by malignant cells will cause cancer cells to pass along the uncommon channels. Infraclavicular lymph nodes. Contralateral breast lymph nodes. Anterior abdominal wall. The blockage of the lymphatic drainage of the skin over the drainage of the skin overlying the tumor cause thickening and dumpling of the skin that look like orange, so it will cause pyodiorrhea. Axillary lymph node drain not only the breast but also pectoral region, upper part of the abdominal wall, upper part of the back, and the upper limb. Axillary lymph nodes are arranged in 5 groups. Number 1, anterior or pectoral group, lying deep to the pectoralis major along the inferior border of the pectoralis muscle. Second, posterior or subcapsular group. Third, examination of the axillary lymph nodes. These 3 figures show posterior group, central group, pectoral group. The axillary lymph nodes are often removed or irradiated by deep X-ray. In such cases, the lymphodynamic in the upper limb filler the axillary lymph node drain into upper lymph in addition to the breast. Surgical anatomy of the metastasis. There are 3 types of mastectomy distinguished between each other. Number 1, external the surgical anatomy of the mastectomy. There are 3 types of mastectomy distinguished by the extent of axillary dissection: radical, modified radical, simple, or total mastectomy. Radical mastectomy involves removal of all the breast skin with lymph nodes as well as pectoralis major and minor and facial. Modified radical involve removal of the breast, axillary, present, pectoralis muscle only. Simple involve removal of the breast only. Triangular of the bed. There is triangular of bed. A radical of the radical mastectomy is formed by the cut. Pectoralis major. The triangular bed followed by a cut pectoralis major minor muscle medially. Medial border of the latissimus dorsi laterally. Superiorly axillary vein. Floor is formed by serratus and subscapularis muscle forming the floor of the skin of the triangle. The long thoracic nerve lie on the serratus. The long thoracic, the content of the triangle. The long thoracic nerve lie on the serratus anterior muscle. The thoracodorsal and subsequent and the subscapular nerve lie on the subscapular muscle. Anatomical complication of mastectomy. Vascular nerve. The vascular injury of the axillary vein and trabecularis, injury to the axillary artery, vascular injury, injury to the axillary vein and trabecularis, injury to the axillary artery and branches, injury to the perforating branches of the intercostal. Nerve injury, injury to the thoracodorsal nerve, injury to the radial and lateral pectoral nerve, injury to the branches of the brachial plexus, injury to the long thoracic nerve. Thank you for your listening.